Hello, this lesson is on apical lordotic chest radiography. When reviewing the evaluative criteria for a routine chest x-ray, you should remember that the entire lung fields must be demonstrated, from the apices of the lungs to the bases of the lungs. Although the entire lungs are demonstrated, the clavicles do angle downward slightly and obscure the apices of the lungs. So, as radiographers, what can we do to demonstrate this area? To demonstrate the apices of the lungs, the radiographer should perform an apical lordotic chest radiograph. This is considered an apiaxial projection. Remember that axial refers to the angle between the central ray and the long axis of the body. This slide demonstrates two methods. The preferred routine is the Lindblom method. Basically, you adjust the patient into the lordotic position with the patient's body about 1 foot in front of the vertical grid and leaning back so their shoulders rest against the vertical grid. As I mentioned, the Lindblom method is the preferred method, but if the patient is unable to perform the lordotic position and lean back without assistance, you can have the patient stand straight against the vertical grid, and instead of angling your patient, you're going to angle your central ray 15 to 20 degrees cephalad or up to obtain the same image. For either of these two images or procedures, you will need a 14 by 17 image receptor, either placed in the upright bucket either lengthwise or crosswise, depending on your patient's size and body habitus. You want to make sure that you maintain a 72-inch SID, just like we use when we do a routine chest x-ray, and you also want to have your central ray enter approximately mid-sternum, but you want to be careful and not, hold true to mid-sternum around that area. In case if the patient has longer lungs, you may have to have it a little bit higher or lower, again, depending on your patient's body habitus, because you want to make sure that you do include the entire lung fields on your image. Both methods place the clavicles above the apices of the lungs that are normally obscured by the clavicles. This last slide provides a visual for what the previous two slides just discussed. This first image is actually showing the patient in the lordotic position. You could notice here is your upright bucky or upright grid. Here's your central ray coming out of the x-ray tube. And if you look at the patient, if they were to stand upright, they would be at least a foot away from the vertical grid, and you can notice that he is leaning back with his shoulders in contact with the wallboard for stability, and the central ray is entering approximately mid-sternum. You would also want to make sure that you would have a left marker in this little lighted area above his left shoulder to help the radiologist demonstrate which side is the left as opposed to the right. The image over here is actually a finished radiograph done in the apical lordotic position, probably the Lindblom method. If we look at our radiograph, we can see both lungs are demonstrated. Here's the heart shadow, but you notice the clavicles are kind of straight across the top of the patient's shoulders as opposed to swooping down or angling down slightly like this, like they normally would. This is to demonstrate, as previously mentioned, the apices of the lung, which are normally obscured by those clavicles. I hope that this little slide presentation helps you understand the concepts of the apical lordotic chest better. Thank you.